Bonjour, mesdames et messieurs. Good afternoon, ladies and gentlemen. Welcome to another session of the CSPC interview series. And today we are pleased to be joined by a guest from Geneva, Switzerland, Dr. Peter Singer, Special Advisor to the Director General of WHO, World Health Organization, Dr. Tedros Adhanom Ghebreyesus. Welcome, Peter, to the CSPC virtual session.
Thank you, Merdad. It's great to be with you and with all the friends and colleagues joining online.
Thank you. I would like to start off with a brief bio for Dr. Singer. Peter Singer is a special advisor to the Director General and Assistant Director General of the World Health Organization. Among many things on this position, he co-chaired the transition team for Director General and was the architect of WHO's strategy and its $3 billion target. He provides leadership to the Secretariat of the Global Action Plan for Healthy Lives and Well-Being to strengthen collaboration for better health among 12 multilateral agencies that channel 1/3 of development assistance for health. Before joining WHO, Dr. Singer co-founded two innovative result-driven social impact organizations from 2008 and to 2018. Peter Singer was the CEO of Grand Challenges Canada. During this period, Grand Challenges Canada raised about $450 million to support 1,000 innovations in more than 90 countries, which have the potential to save approximately and up to 1.6 million lives and improve many more millions lives by 2030. From 1996 to 2006, he was Sun Life Financial Chair and Director of the University of Toronto Joint Centre for Bioethics. He was also Professor of Medicine at the University of Toronto and Senior Secretariat at University Health Network. He is the recipient of Michael Smith Prize as Canada's Health Researcher of the Year in Population Health and Health Services, and also he is the Officer of the Order of Canada for his contributions to health research and bioethics and for his dedication to improving health of people in developing countries. He's a Fellow of Royal Society of Canada, the Academy of Health Sciences, where he was Foreign Secretary for some time, and the U.S. National Academy of Medicine and the Academy of Sciences for the Developing World. As a researcher, Dr. Singer published over 300 articles, received over $50 million in research grants, and mentored hundreds of students. He studied internal medicine at the University of Toronto, medical ethics at the University of Chicago, and public health at Yale University, and management at Harvard Business School. He served his community as board chair of Wrexham Hall, an internationally minded school for girls. While this is a very impressive CV, Peter, I have to mention for our participants a strong link between Peter Singer and the CSPC. Peter was the director of Sandra Rotman Center at University Health Network when I was doing my fellowship there and just started the idea and the work for CSPC as the first forum on science policy. He and all the colleagues at Sandra Rotman Center supported me. The SRC kind of incubated the CSPC and its very first 2 years by providing me with the space, advice, and more importantly, the paycheck so that I can focus on the development of the CSPC work. And I hope Peter feels that investment is considered among the other work that he had done was impactful. Thank you, Peter, for being with us.
Thank you, Merdad. I think it was a great return on investment. It's great to see you and the CSPC doing so well.
Excellent, thank you. So now we are going to start our interview session for approximately another 40 minutes. And I will ask a few questions and then participants will have time to ask questions by writing those questions in the Q&A box, which is at the bottom of Zoom window. Please do not use the chat box for asking questions and feel free to vote up the questions. Currently, we have 83 participants, and without any further ado, I go to ask the first question. On July 21st, just about 6 days ago, you published a piece praising the role of the WHO in Canada's response to the pandemic. For those who may not have read the piece, could you please elaborate? What are your reasons for such a statement?
Of course, and thank you, Merdad. Just to set the scene, COVID is probably the most important health challenge the world has faced in 100 years, and one of the most important global challenges. As of today, there's more than 16 million confirmed cases and more than 640,000 deaths around the world. So this is a serious, serious problem. The main point of my piece was that WHO is relevant to all countries. It's critical in low-income countries, it's critical in high-income countries, it's critical to the health, prosperity, and security of Canadians. Internationally, of course, all the things that go with multilateralism, and Canada is a strong advocate of that. The early warning that WHO gave about the pandemic, the supplies, including diagnostics, that it supported early, the workforce, including training, and the leadership and global solidarity it showed, but also domestically. And this was a point of the piece, that Canada benefits domestically from WHO's guidance, for example, on reopening, from WHO as a platform to share lessons. For example, our health minister presented the experience of Canada, as have many health ministers around the world, sharing lessons and challenges, and also the issues of science and this very important issue of speeding up the vaccine, both in terms of accelerating the progress of the vaccine and ensuring equitable access. So that was the point of my piece. WHO is critical to Canada, and really look forward to discussing with you, Mehrdad, and the people online some of these points.
Thank you. You mentioned about the minister's work. I just want to know if there are direct links between Canadian policymakers and public health authorities and WHO in coordinating the response to COVID.
Mehrdad, there are many, many direct links at all levels. Actually, right from the Prime Minister, who appeared in a pledging event for the Access to COVID Tools Accelerator that's dealing with acceleration and equitable access of vaccines, therapeutics, and diagnostics, through the health and development ministers, through government officials, public health officials participating in strategic and technical, many strategic and technical networks on a regular basis, through technical experts in academia, and also civil society. So multiple links. Take one example, the World Health Assembly a couple of months ago. Canada had an important role in the resolution at that World Health Assembly, as did several countries, where all the countries of the world came together to agree and to declare that vaccines were a global public good. This is a very important, if you will, geopolitical basis on which to build some of the technical issues around vaccine acceleration and equitable access. And that's just one example, multiple links at many levels. And WHO is, of course, very grateful for the contribution of Canadians, including the ones who work here. Many of the colleagues are Canadian as well.
Okay. You mentioned a lot of good things that WHO is doing with respect to pandemic, but as you know, WHO performance in response to COVID pandemic has been criticized among some circles, including the President of the United States, accusing WHO of being late in responding to the pandemic. And I just want to ask you, you are in a close circle to Dr. Ghebreyesus, Director General of WHO, and have influence on decisions. And what is your response to that criticism?
Of course, we hear those criticisms. WHO has always had an inclination towards reviewing its performance, towards continuous improvement. That's happened after every major action, and it continues to happen now. Just to go back to some events, within days of being notified on December 31st of the outbreak, WHO notified member states around the world, notified the public, provided guidance, supported development of the diagnostic, began direct support of countries through 150 country offices around the world, and through country missions, and also supported training, online courses have trained more than 4 million people to date, culminating in January 30th, when WHO, the Director General, declared a public health emergency of international concern. That's the highest level of global alert. That was declared at a time when there were only 100 cases outside of China, no deaths. And it's 6 months ago this Thursday. So ask yourself what's happened. The countries and communities that have followed WHO's advice carefully and consistently have done well, either in preventing large outbreaks, and examples of this would be New Zealand, Rwanda, Thailand, Vietnam, Pacific and Caribbean islands, or in bringing large outbreaks under control. And Canada is an example of this, as is Germany and Korea. Now, I could name other countries, but that's the case. Nevertheless, we're committed to review. The Director General proposed and member states agreed for an independent and comprehensive review of the international response, including but not limited to WHO's performance. And the co-chairs of that review have been named: the former Prime Minister Helen Clark, former Prime Minister of New Zealand, and the former President of Liberia, Ellen Johnson Sirleaf. So that would be my response. Let's keep our eyes on the prize. We all have a lot of work to do, and the only way to really defeat COVID is together.
It would be very interesting for many to know what has been happening and how is the situation in WHO executive offices, if you will. How is the decision-making process was during the peak of the pandemic, which was very hectic for many, month of February, March, April, or even May. Could you portray this situation and at that time in the decision in the executive offices of WHO? Was it chaotic, or how it was?
Yeah, so I feel so proud to be part of the WHO team. WHO colleagues have really worked around the world and around the clock since first notified of the outbreak on December 31st. As I mentioned, now 6 months after the declaration of a public health emergency of international concern on January 30th, what's remarkable is that the pillars of the response remain the same, namely global solidarity, political leadership, empowered communities, and also the mechanisms, the real mechanisms at the heart of the response remain the same, namely testing and identifying, isolating, and caring for every case, tracking and quarantining every contact, and the various other public health measures of physical distancing, avoiding crowded indoor spaces, wearing masks, washing your hands, staying home when you're sick. These are the bread and butter public health measures that will allow us to live with the virus. Looking forward, and I think this is important to your community, science has a critically important role to play, obviously. Especially the vaccine, but also therapeutics and diagnostics. And just on the vaccine, as we develop better tools, there's currently over 165 vaccine candidates in the pipeline. That's important because on average, the success rate for vaccine candidates is 10%, so you need a robust pipeline. About 25 of those are in human trials. About 3 to 4 are in phase 3. And what's really important, in addition to accelerating the vaccines and other tools based on science, is how these are equitably distributed. And that's why it's so important that WHO's built on that member state resolution I mentioned of immunization being a global public good, to develop a global allocation framework for the equitable allocation of tools, new science-based tools, including vaccines. So there's been a lot to do. And that really, I think, describes the focus of the work.
You touched on this question that I'm going to ask briefly at the beginning, but I want to ask you now, you can have the chance to elaborate. What do you think Canada should do to play a bold role in WHO and its operations, and why it is important for our foreign policy?
Yeah, I mean, I may be a little biased, as are you, but I think Canada has an incredibly important role to play in international affairs, in its foreign policy. It's a G20 and a G7 country, and it's a country with a strong historical commitment to multilateralism. I think it's important to say Canada's already played an important role in its domestic public health leadership and also in its support of the multilateral response. It has really supported the humanitarian response to date. And as I mentioned, supported the Access to COVID Tools Accelerator and supported the response in many other ways. Now, WHO is at the very center of that multilateral response. And so there's a great opportunity to build upon WHO's leadership, Canada's leadership, to really strengthen that collaboration even further, which provides, I think, a very important opportunity for Canada to lead and to act on what really is, I mean, I think everyone would agree, probably the most important challenge globally and domestically of our times.
Thank you, Peter. And the last question from me is a personal question. We are connected through social media, and I noted that apparently you have been infected with COVID. If you are comfortable telling us and the audience about your personal experience with COVID.
Yeah. So both my wife and I had COVID early in March of this year. Thankfully, for both of us, it was quite mild. I had cough and fever. My wife actually lost her sense of taste and smell. And so we were very lucky that we were one of the 40% or so of mild cases. At the same time, it was a very humbling experience. And it made us think very much about those with more severe cases. And really, I just want to take this opportunity to offer my condolences to those who died of COVID, more than 640,000 people around the world, and many, many more families who suffered those losses. One of the lessons that we took out of that experience was that we're all vulnerable. We didn't expect to get COVID. We didn't think we had COVID initially, but it was proven by PCR, and at this point, we also have antibodies. The other thing we reflected on, in addition to vulnerability, is just how important global solidarity is, just how important leadership is. And really, I was very grateful for WHO, the things that we've talked about, its leadership. And for me, also, I was able to reflect on the calm and principled leadership of Dr. Tedros, and that calm and principled leadership has saved many lives. And I think the role of WHO, the importance of leadership, the importance of global solidarity is something that I had a lot of time to reflect on when we were at home.
Thank you, Peter. And now it's time to go to the questions from participants. As I can see in the chat, in the question and answer box, there are a number of questions already, and feel free to write your question and vote up any question if you like. And please do not use the chat line for that. And meantime, I want to ask my colleagues at CSPC office to share a one-question survey at this point about the sector that you participants are coming from: government, academia, private sector, nonprofit, or others. These questions help us to tailor our programs and our sessions accordingly, and I appreciate in advance for your kind response to this. So the first question is from Paula Chidwick, and my advance apologies to all of you if I mispronounce any name. Paula is asking, my question is about ethics, COVID and vaccines. How important is the role of trust in the process of development and implementation of global vaccine solution? This question liked by 5 people, by the way.
Well, thank you very much, Paula. And let me just say it's a pleasure to be reconnected. Paula and I had the opportunity to work at an earlier time together in ethics, and including at that time on issues of public health ethics related to SARS. And let me just say that I think the issues of ethics are central to the public health response generally to COVID, and also to the issues in vaccines. mentioned earlier the importance of an allocation framework for vaccines. It's very important that that allocation framework be based on sound ethical principles. WHO actually, in its R&D blueprint, which is part of the development of this whole thing, has an ethics group. It's actually led or co-led by Ross Upshur, who was very involved in the work on SARS, a Canadian public health ethics expert. And to Paula's point, the issue of trust is central to the ethics and indeed the effectiveness of the response. Implementing those values is also required, making ethical values the foundation of a response, and also having a very operational response that touches lives. So that type of interdisciplinary work and translation, if you will, is extremely important. But, you know, bottom line is ethical values are extremely important to the whole public health response, including the development and allocation of vaccines. Trust is a critical value. And the challenge before us, as countries take different positions, even though all of them agreeing that a vaccine is a global public good, is how really to ensure that those ethical values are translated into practice. So thank you, Paula, for that question, and thank you for your work.
So the next question is by Regan Shale. New study shows 1/3 of the world is at risk of running out of life-saving AIDS drugs due to failure to deliver medicines, difficulties with transport, and limited access to health services. WHO and UNAIDS predict 6 months disruption can result in doubling HIV-related deaths. What do we do about this?
Yeah, thank you very much. And that's an excellent question. And it lets me elaborate, I think, on a very, a point that would really be, I think, good to stress, which is, I talked earlier about the 640,000 deaths, 640,000 plus deaths. Those are the direct deaths from COVID that we know about. Think about this as a pebble being dropped in a well. In that inner concentric circle are the direct deaths. In the next concentric circle out are the deaths that come from disrupted access to health services. And essentially, these are the HIV deaths that were mentioned, but also malaria, tuberculosis. There's estimates and models around women and children's health. There's estimates and models around non-communicable disease, hypertension, heart disease. Those stories affect every country. And it's not only supply, it's also demand for those services. So that's the middle tier. But the third rung is the social determinants, the hunger, the poverty, the issues of migrants and refugees. And it may well be possible that as you move out on those tiers, the number of deaths and the amount of suffering increases. So that's a description of the problem. And I think it's really important to think about that in a holistic way, which is why I say this is really one of the biggest challenges the world has faced in 100 years. Now, the question was about solutions and focusing particularly on access to health services. I think it's really important in the response for us to zero in on those services to make sure they're adequately supported in the short term. There are funding moves that, for example, Global Fund, Gavi, et cetera, have made in relation to those deaths, in relation to that access issue to prevent those deaths. The technical support from WHO, but the most important work actually, of course, is always done by governments themselves. Every government in the world needs to focus on that tier in terms of solution. And this also implicates not only the immediate response to prevent those immediate responses, but the recovery phase. And very important to build back with resilient primary healthcare systems, which can prevent future shocks and also address the current situation. So in summary, it's important to have a holistic picture, including access to health services, which is really a very, very serious issue for HIV and for a swath of other conditions. It's also important to think about the immediate response to prevent those deaths, which likely are larger than the direct deaths from COVID, and to act, and that principal responsibility lies with governments themselves. And then, and they need to be supported by the multilateral system and, of course, other countries in global solidarity. And then finally, the issue of recovery, building back better, and how we build back healthier, greener, the role of resilience in health systems, primary health care, and so on. So thank you for that question. I think it's very important for people to see both that whole picture and focus on the whole picture, because at the end of the day, our goal is to save lives, whether that's from COVID, whether it's from HIV, whether it's from NCDs, hypertension, heart attack, or other conditions.
Thank you, Peter. Next question is by Gary Aslanian. As Canadians working at WHO, what can we do to help our Canadian public health community to ensure there is global health leadership in the form of WHO's maintained, in the form that WHO is maintained? Do you think Canada needs to develop a global health strategy that would make global health an issue of domestic importance? And if so, how we can help do that if it feels that at the moment the approach is still disjointed? And thank you.
Yeah, I mean, Gary was one of those people I was talking about earlier, a distinguished Canadian who's here at WHO working on these issues. So thank you, Gary, for the work that you do, and thank you for that question. Of course, we are all here as international public servants. So we're here without fear or favor of any country. WHO treats every country the same, 194 member states. At the same time, I think that people like Gary have very important social connections with their fellow Canadians, and the more that people like Gary, people like Bruce Aylward, and many other Canadians are out doing what we're doing here, which is exchanging ideas, talking about WHO, listening to questions, queries, even criticisms, which we embrace and welcome. The more we do that, the more we engage, the more understanding there is in our countries of origin, and arguably the more support. We've spoken about Canadian foreign policy. I think Canada has, as I mentioned earlier, played a strong role domestically. We've got some terrific public health leaders provincially and federally. We've had good support of the multilateral, strong support of the multilateral response. And so I do think there's some terrific opportunities for government, for civil society actors, for academia, and for the private sector in Canada to come together in support of multilateralism. One of the things that have been done is the Solidarity Fund, and which has raised $225 million around the world. And there's a partnership with the King Baudouin, the KBF Foundation in Canada, which actually lets Canadians support individually, financially, with charitable donations. But this is really just a mechanism of engagement. The important thing is for Canadians to engage, Canadians to support their government, to act in this multilateral way. Because if there's one thing I've learned, having spent most of my life and career in Canada and now working in WHO as a UN official, is that multilateralism is vital in all kinds of ways in this world. And Canada has a very important role to play in the multilateral system. And it's obvious that the multilateral system is being tested and is under stress. And it's also obvious that it is responding. And so we all need to come together, really, because that's the only way that this virus, which Dr. Tedros refers to as public enemy number one, will be defeated.
Okay, next question is by an old-time friend, but former colleague of both of us, Rahim Rezai. There is an ongoing debate about COVID testing and what level of testing is appropriate. This seems particularly salient in the US. Could you comment on what the right level of testing is? And is there a point where benefits of testing diminishes, particularly in situations where COVID cases seem to be skyrocketing, like some areas of the US?
Testing is vital. It's actually at the centerpiece of the public health response. It's one of the issues I mentioned earlier, you know, the early release in early January by Chinese scientists of the genomic sequence, and then the picking up of that sequence and the development of the first diagnostic test in a German laboratory, and then WHO helping to provide guidance and ultimately shipping those diagnostic tests around the world and other countries picking it up. That's a very, very important piece of the response. Everyone talks about vaccines, everyone talks about therapeutics, but diagnostics is really the atrium to therapy, and it's the atrium to public health. So first point, diagnostics, incredibly important. Secondly, innovation in diagnostics is important. When I had COVID, for example, my wife and I had this long Q-tip swab in our nose going to the back of the nasopharynx, and then the testing, the results came back. It's important that those results come back quickly, and point of care testing and innovations on that sampling technique would be extraordinarily important. And that, by the way, is a focus of the Access to COVID Tools Accelerator. Thirdly, testing rates are a very important part of the public health response. You know, one of the places I'd recommend people go, in addition to the WHO website, of course, for information, is there's a website called Our World in Data based at Oxford, where you can actually go and see the different testing rates at different times of different countries and the outcomes, and see for yourself how your country compares or how other countries compare. And you will find there certain guidelines, which was your question, Rahim, around adequate testing. I don't want to put a particular number out there, but I do want to say that it's very clear that you want to test many, many people for each positive, and that's an important part of the response. And just want to thank Rahim as well for his work. It's great to reconnect with many, many old friends. You know, there's so much that COVID has taken away from us. It's also important, I think, to see what it has given us. And this is a small but concrete example, Mehrdad, the opportunity to reconnect with you, with other colleagues like Rahim and Paula and Gary, of course. So I think it's important to stay optimistic as well about the situation, because we're going to each need to lead our way through. And we're going to need to do that together as well to defeat this very, very significant foe.
Thank you, Peter. Before going to the next question, I want to ask my colleagues at the CSPC, please launch the second question. And I appreciate if the participants respond to this about the region that they are coming from. Again, that's part of our evaluation of the work that we do and helps us to improve our work. The next question is by Catalina Lopez Correa. She's the Executive Director of CanCogen Project. And WHO has supported massification of testing around the world. Are you also supporting science and innovation, in particular genomics, to help understand and control the COVID-19 virus?
Yes. Hello, Catalina. And genomics has a very, very important role to play. You know, right from the beginning of this response, it was really with landmark speed here that the genomic sequence of the virus was released in early January, received by WHO, released by scientists. And that did lead to the very quick creation of TEST, which is central to the response. I think it jump-started efforts on vaccines. And so, and of course, tracking the genomic variation is also extremely important. To date, while there is genomic variation, and this is carefully tracked, including by WHO, there does not appear to be a significant change in either the transmissibility or the lethality of the virus, which is really the important issue. So genomics has a very, very important role to play. In a sense, there's really two key elements to the response. There's many elements to the response. You need a comprehensive package, but you can think about it as two fundamental things. One is the whole package of, if you will, the shoe leather epidemiology. What's at the center of the response is the public health. the isolation and testing of cases, testing and isolation of cases, the contact tracing and quarantining of contacts, and that other suite of public health measures that help tamp down. But the only countries that have been really successful have had very robust testing, isolation, quarantining of contacts, including when they crop up again during reopening. So that's the first pillar, if you will. The second pillar is the science, the innovation in tools, the things the Access to COVID Tools Accelerator is focused on, the vaccine, the diagnostics, the therapeutics, and that's critical. And this all sits on a foundation of political leadership, empowering communities, and global solidarity.
Great. Next question is by Jan Matas. Aside of fundamental and clinical research, the pandemics reminds us the crucial role of awareness and education in order to cope with crisis and to prevent future ones. What are the WHO's initiatives in this domain?
Yeah, so thank you for that question. Public information, public awareness, public engagement is vital because empowerment of communities is essential and political leadership is essential. And WHO has actually done a lot on this score, beginning with its press conferences. Dr. Tedros and other very senior colleagues leading the response have met the global media 2 or 3 times a week, almost since the beginning of this pandemic. A month or so ago, they had done this 75 times. I mean, it's probably approaching 100 press conferences. They're now every Monday and Thursday. I actually tweeted the times today at Peter A. Singer. Have a look. Please tune in because the media join by a Zoom link, but it's on multiple social media platforms. I watch every presser and I think it's great information. So that's one. Secondly, there's a lot of support to countries through the country offices, through missions, providing information through that channel. Thirdly, there's a lot of misinformation about COVID. And WHO has an extraordinarily active social media strategy and some very good cooperation with major social media companies like Facebook, like Twitter, like LinkedIn, many kind of Google. So if you're going to look for information, often it takes you to validated WHO sites as well as local sites. And that kind of cooperation is very important to combat misinformation and to provide accurate and valid information in partnership, for example, with social media and other major media companies. And then maybe finally, tapping into popular culture, working, for example, with Global Citizen on some global concerts that have been held that bring in a wide range of people. So multiple channels for validated information, even through gaming channels, which turns out to reach billions and billions of people. Multiple channels, validated information, engaging with communities, engaging with people, providing valid information as the guidance evolves is a critical piece of this epidemic, and the type of thing we're doing here and pieces in the media, I think, are a part of that in Canada. But each of us have a role to play in that. Many of the people actually in this audience, I saw we have some very distinguished people, a former clerk of the Privy Council, the former managing director of the World Economic Forum, Mel Kapp, Robert Greenhill have signed up. I think they're out there. This isn't just about WHO, it's about all of us providing valid information around our kitchen tables and for all Canadians really to inform themselves, empower themselves. Because as Dr. Tedros said, everybody is their own risk manager, and the actions that you take will affect not only your own health, but the health of your family and the health of your loved ones and the health of your friends.
Thank you, Peter. Next question is by Dr. Betsy McGroger, former Harvard Medical School Fellow on Ethics, Science and Governance. And the question is, could you shed light on the application and importance of a systemic application of a gender diversity lens in the trust, ethics, and trust? Yeah, that's the question.
No, I mean, Betsy, and hello, Betsy, is asking a really vital question about bringing a gender lens to the response and to preparedness efforts, and it's absolutely vital. And gender affects this response in so many ways. The need for gender disaggregated data around cases and testing and mortality, the fact that most of the workforce, the majority of the workforce, the health workforce around the world, community health workers who are vital in this response, and the public health workforce are women. The issues around services for women, not only reproductive, maternal, child health, but a wide suite of services, access to family planning and others. Just to name 3 ways in which gender really affects this response. So it's critical to bring a gender lens to the response. In WHO's own strategic preparedness response plan, we have brought these lenses and more, and it's very, very important to keep that gender lens engaged through the SDG Global Action Plan. We work very closely with UN Women, with UNFPA, and others, UNDP, and it's very, very important. UNAIDS, which was mentioned earlier, very focused on communities and civil society as well. These lenses are extremely important. They need the response, future preparedness efforts, and the recovery needs to be gender responsive, and we need to implement that through ongoing discussions with people around the world. And there's some terrific leadership groups in civil society on gender as well, like Women in Global Health, Women Lift, and so on. So all those voices, we all need to work together to make sure that the response is gender responsive. And I think WHO is highly attuned to that. We also have quite a gender balanced senior leadership team and a diverse one. Very sensitive to the civil society and community issues as well, because that's what makes the response stick. What makes any response stick is communities, is empowering communities and reaching everybody in those communities. And women are often at the heart of communities and leading those communities. So this is not only the right thing to do, it's also the effective thing to do in terms of mounting a response against COVID-19. Thank you, Betsy, for that question and the opportunity to elaborate on the importance, the critical importance of gender.
Okay. And I hope, Peter, you don't mind that we extend a few more minutes because there are lots of interesting questions. And one from David Castle. Hi, Peter. The drug development pipeline for the last 50 years has, for the most part, not been geared toward public health, let alone vaccines. Do you think this is a pivotal point for global biotech to move away from the blockbuster drug R&D paradigm? Apart from direct subsidy from government, do you foresee a new financial model for vaccine or research and development? Yeah,
I mean, firstly, hello, David. It's great to be in touch, and thank you for your leadership in science and in science policy. It's much appreciated. To be specific, firstly, on therapeutics. So the first set of moves was around old drugs for new diseases, effectively. And let me just emphasize that one of the things that makes COVID so difficult is it's a new disease. It's a new virus. There's a lot of unknowns. It spreads quickly, and it's a killer. That's what's made it such a challenge. The inherent characteristics of this, and so in that context, the initial focus was on old drugs for this disease. There was trials launched, including WHO's own Solidarity trial, on the theory that pooling patients from around the world would get to an answer quicker. pooling enrollment. There are now some proven effective therapeutics. There's some evidence for dexamethasone. There's some evidence for remdesivir, and so on. And don't forget oxygen. Oxygen is the single most important drug in the world, probably, when it comes to COVID. And many, many trials underway. So there's hope on the therapeutic front, and the Access to COVID Tools Accelerator is very much focused on this. In terms of the financial model, David's right, of course. Now let's put this into context. There is probably, last estimate I saw, $10 trillion of economic damage related to COVID, related to this outbreak. Maybe it's higher. This is different from the financial crash because this is in the real economy. GDP shrinkage of 5% or more, depending on which country you're in. And that's the context against which the financing of any of these tools needs to be taken. The only way to solve the economic crisis is to solve the public health crisis and to use science and develop tools to essentially do that, building on what is the most important foundation of public health and leadership and global solidarity. So I think people are looking at the financing of scientific tools differently now, as they should be. And I'm sure new models will develop. The COVAX facility in the ACT Accelerator is an application of the advanced market commitment model for development, in this case of vaccines. 75 countries have expressed interest. 90 countries would, in addition to that, would benefit. And this is done as an advanced market commitment for every country. So I think there are new financial models developing, in this case for vaccines, but it will also be the case for therapeutics and diagnostics. And I just wanted to put the financing issues of those tools in the context of the social and economic damage of the pandemic, because I think that's the context in which we need to see them. Thank you, David, for your question and the opportunity to elaborate. And again, thank you so much for your work and for your leadership in science in Canada.
I want to ask my colleagues at CSPC to put the third and the last question to the audience in terms of evaluation, how we are doing, how you like this session. Please help us to improve better and improve our work and get better, and send us your ideas. We'd love to hear from you. But the last two questions, perhaps they're very interesting, Peter. One is thanks for the important work by Sana Nafa. Thanks for the important work you're doing. Do you think that COVID-19 would change WHO and countries' priorities set and on the overall SDG agenda? And would the crisis in countries affect the level of funds to multilateral organizations?
Yeah, well, let's start with the SDGs. The SDGs are the Sustainable Development Goals. They're universal. In 2015, the countries of the world agreed on these goals to achieve them by 2030. And definitely that was hard enough without COVID. And there's no question that COVID has set us back, set countries back on the Sustainable Development Goals. And that is a very concrete example of that was the earlier question about access to HIV and HIV outcomes. And HIV incidence is an indicator under those Sustainable Development Goals, just to take a concrete example. Now, it's the multilateral system that supports countries to achieve Sustainable Development Goals. And so it is very important to strengthen the multilateral system. WHO is at the heart of that system. So it's very important to strengthen and support WHO. There's no question that the whole world has changed. Every country will have changed. The multilateral system will have changed. Our partners in civil society and the private sector and academia will have changed. And of course, WHO itself is always changing, always adapting, always learning, always improving. The question is how we can do that together. Really to fight this enemy and to get the world back on track to achieve the Sustainable Development Goals. At the recent UN conference, what was to be the decade of action on the Sustainable Development Goals is now likely to look like the decade of recovery. But having said that, and to get to the financial part of the question, again, you need to look at the financing of the public health response, of the multilateral system, of WHO, and of governments in the context of the social and economic damage that's been caused. This isn't health versus the economy. The only way to improve the economy is to improve the public health response and to support the development and equitable distribution of the scientific tools. And at the top of that list would be the vaccine, but in HIV and other examples, we don't have a vaccine, and we make tremendous progress in longevity through therapeutics and through diagnostics, which are also extremely important.
Peter, interesting questions keep coming. One interesting question by Satya Dash from Berlin. Thanks for joining us from Berlin. And the question is, thanks for wonderful insights and leading WHO during these turbulent times. My query is about what strategies can developing countries, low, medium income countries take to stop the spread of COVID-19 infection, especially in geographies that have poor health systems and capacities. How smartly can they leverage on-ground infra they may have for other infectious diseases, such as tuberculosis?
Yeah, it's a very important question. And in fact, in some ways, you could almost argue that some low and middle income countries have an advantage. They are used to they're used to these public health measures in an Ebola response, in a tuberculosis response, in a polio response. In many of these cases, it's the same fundamentals. It's testing, identifying and isolating cases, tracking and quarantining contacts. And, even countries like the DRC, which unfortunately have had to fight Ebola, have very well-tuned muscle memory on these issues. And this is the same muscle memory that's needed to fight COVID. So just want to very much emphasize that the heart of this response is the shoe leather public health. We should ask, every country should ask, well, what is our workforce in public health, in contact tracing? So in some ways, so-called developing countries have an advantage because they've been using these reflexes. At the same time, if you look at G20 countries, these countries presumably had pretty good IHR preparedness, and yet there's a significant range of outcomes. So it's not just the capacity you have, it's also how you use it in a functional way. And so the question that's being asked is actually a very important and nuanced one, and one that every country will really need to carefully reflect upon and carefully analyze. And that's, of course, very well known to Canadians because, in a sense, in the context of a very, very robust public health response with excellent public health leadership at the federal, provincial, and local level, we had a tragedy, really, in long-term care facilities. And that's where more than 80% of our deaths were in Canada. So every country has a different experience to share, different positives, different negatives, and very important for every country themselves to learn those lessons and to learn from their peers. Since the question's from Berlin, let me just say that the countries like Germany, right up to the Chancellor, that are not only firmly behind the multilateral system and firmly behind WHO, but also acting on that, I think are really models for us all and demonstrating what support for robust multilateral response can look like. And I think Germany is a great great model and supporter of the multilateral system, as are many other countries, as is Canada. And I think this is really a way to help shape our foreign policy, but also our domestic policy. Because if there's one thing COVID has taught us, is that foreign and domestic policy come together in the case of COVID, and we can only solve this problem together as a world. And the leadership of countries like Canada is vital.
Thank you, Peter. And the last question, it seems that medical science must be checked by, apologies for this interruption, the questions just jump the queue. It seems the medical science must be backed by good policy and leadership in order to effectively implement public health measures. Do journalists play a role at this intersection? Are there ways that they help or hinder these measures?
Journalists play a key and critical role. I mentioned what now must be approaching 100, maybe not quite 100, press conferences that have been held by Dr. Tedros and WHO leaders of the emergency response since the early days of the outbreak. Those press conferences are obviously with the world's media. The world's media is obviously made up of journalists. And the engagement of journalists, the seriousness with which they take this issue, the thoughtfulness with which they take this issue, the way they transmit accurate information is extraordinarily important. I talked about social media before, but traditional media is extraordinarily important. And we've got some amazing examples of science and health journalists who actually know this field at least as well as any technical expert. And I think we're all in the debt of our journalist colleagues who are really communicating with the public in an accurate and effective way. And they can serve also for models for their colleagues. So leadership matters, information matters, and most of all, global solidarity matters. The only way we'll be able to defeat this foe is with humility, with national unity, with global solidarity, and with our own individual leadership empowering communities to really take on this foe. And we will prevail. We will be successful. We will come out of this, and we will do it together.
Thank you, Peter. And that brings us to the end of this interview session. And before the last opportunity to speak to Peter, let me just thank all of you for participating at this session. It was a very exciting one. We went almost 15 minutes over time because there were so many good questions, and patiently Peter answered all of them. Thank you for that. The next session will be on August 13, and an interview with Rob Annan, President of Genome Canada, in the occasion of 20th anniversary of Genome Canada. Please take a look at the link and click on the link for future virtual sessions. And this will bring to the end. Peter, over to you, the last word.
Well, the last word is it's just great to reconnect with you, Mehrdad, to reconnect with many colleagues online. And let's continue the conversation. I'm at Peter A. Singer on Twitter, and let's continue to be in touch, because this is an unfolding situation. We'll need to work together. I feel very proud to be a Canadian at WHO. I feel very proud of WHO. I feel very proud of Dr. Tedros, my friend and colleague, for his leadership. And I feel that COVID has taken so much from us. I'm also optimistic that with the appropriate public health measures as the foundation, with the global solidarity and leadership, and with the very important role of science, not only the development of tools, but their equitable allocation, together we shall prevail. And thank you, Mehrdad. Thank you very much, everyone, for joining. And it's just really a privilege to hear the questions and to be able to comment, and would love to do this again sometime.
Absolutely. Look forward to having you in future events, including the annual conference. Thanks, everyone, and have a wonderful afternoon or morning, depending on where you are, or night. And we'll see you soon.
Thank you.